My name, as you can see on the screen, is Robert Levitt. All of those acronyms after my name mean that I'm certified to do particular things in physical therapy, one of which is the LSVT BIG that Mark referred to earlier. So my board certifications are also listed there. Suffice to say, all of that stuff really means is that I'm relatively good at taking tests in general. The LSVT certification down there I've had for multiple years, the first time being in 2011. They require us to get recertified every couple of years. As the work does change slightly and the research behind it improves, it by no means is the only thing that you can do to combat the effects of Parkinson's. In fact, it's been pretty clearly shown that just a regular, vigorous exercise program will do a lot towards making your quality of life better. Anyway, I'm assuming you all know what Parkinson's disease is, and I've highlighted the differences there between Parkinson's disease and Parkinsonism or Parkinson's syndrome. Both are neurodegenerative in nature that cause at least the Parkinson's disease causes nerve cell damage in the substantia nigra, the part of the brainstem that produces dopamine, which has a strong effect on overall body movement. So what are the effects of Parkinson's specific balance deficit? So Parkinson's disease, as I said, is associated with the gradual loss of cells in the substantia nigra of the brainstem where dopamine is produced. Dopamine is responsible for the modulation or the control, the nuanced control really, of central nervous functions, not just movement, but things like pleasure and attention, some short-term memory, mood, and interestingly, motivation. That's a whole other topic for a different day, if I can cover it in the detail that it would require. All right. So the loss or reduction in the production of dopamine will lead to certain movement alterations and dysfunctions. So slow movement, also called bradykinesia, means that your motions are delayed in the speed at which they're produced. Reduced movement size or reduced movement amplitude is called hypokinesia. That means that the scale of the movements that is produced in a Parkinson's individual are reduced in their size as well as their speed. All of this leads to postural and rigidity maladaptations and gait abnormalities, one of which includes falling. And that's the primary interest in my talk today is that particular part of Parkinson's related deficits. So what is the PT treatment for Parkinson's specific balance deficits? As I alluded to earlier, it's probably more like 30 years of research now that I developed this talk a while ago. Is pretty clear in that a lot of good empirical studies have been done that a regular exercise program is vital for maintaining muscle tone and strength and endurance and flexibility, and not just for patients with Parkinson's. It's actually beneficial for almost everybody else, with a few exceptions. Regular exercise will help you both attain and maintain a better quality of life, and along with a healthier lifestyle, it's important to address the relevant fall risk factors that each individual may present with Parkinson's. Hopefully that is not the case and you're listening in watching this talk just for a purely academic interest, but I'm assuming that most of you who are watching me today have some interest in what you can do to improve your health and vitality and decrease your overall fall risk. Okay, so physical therapy will help in Parkinson's specific deficits by performing an extensive musculoskeletal evaluation to determine your strength and endurance and flexibility, and specifically to find any balance deficits and how this is influenced by your Parkinson's disease. So PTs hopefully will also help you develop a regular exercise program because the main benefits from physical therapy are not accrued during the treatment sessions. They're actually accrued well into the 6-month span of time after physical therapy has been concluded. So physical therapy hopefully points you in the right direction that you need to go to continue to maintain and to attain rather and maintain your overall health and vitality. And in this particular instance, with a specific mind towards improving your balance. PT can also help you optimize your overall health and improve your function. So what is your fall risk? There are many ways to assess balance that we use in physical therapy. Some are quite complex. I've listed the names of the tests there. Some are relatively simple. I've highlighted one of the more simple ones. I generally give this talk in a person-to-person approach, and in this point I have everybody stand up. I'm not going to ask you all to do that at home, and try the single leg balance test just to get an idea of where your risk might lie. So Standing on one leg, or your ability to, maybe I should say not stand on one leg, is a pretty clear indicator on your fall risk for the next 12 months. So how is this test performed? It's not very complicated, which is why it was in the simple section. So you literally decide which leg to stand on. Doesn't matter. You can choose the other one if you don't like the results from the first one. A stopwatch is used to measure how long you can stand and balance on one limb. Any other point of contact, meaning if the limb that you're holding off the ground does touch your stance limb, or it touches the floor, or your hands touch the wall, that ends the time trial. Three trials are allowed, so that if you miss it the first time, you get another couple tries. So what does all that information mean? I've indicated the normative values here in decades of life. It is broken down further into 2-year spans, as I remember, but that's an awful lot of information, and it didn't fit on one slide. So from 60 to 69 years of age, you should be able to stand on one limb for 27 seconds on average. That's plus or minus 6.4 seconds or thereabouts. So as you can see from the information here, the older you get, the lower the time that most people, and that's what this time is, it's an average of how the basic 80 to 89-year-old, how long they can stand on one leg. It is not specific to Parkinson's disease. But I'll go more into that in a little bit. So the farther below average you are on those times there, the more likely you are to fall within the next 12 months. But it is not the only way that we use in physical therapy to calculate your fall risk. There are a lot of other things as well, and there are a lot of other things that include increase your fall risk overall. So what are those things? Risk factors specific to Parkinson's disease are things like the severity of how long you've had the Parkinson's symptoms, any freezing, involuntary movements, any gait abnormalities based upon postural or muscular rigidity or joint rigidity, and any postural instabilities. On average, a person with Parkinson's disease, and again, this is average amount, so that's everybody from essentially 65 through 95 is what the study was done on. But Parkinson's will increase your fall risk all by itself by about 38%. So that means because of Parkinson's, you have a 38% higher chance of falling within the next 12 months than if you didn't have those. Good. So there are other fall risk factors in addition to Parkinson's disease. These are endemic to any person over 65, and they greatly depend upon their severity. So obviously it makes perfect sense that the more visually impaired you are, the higher the fall risk would be, just because you wouldn't see barriers that were in your path as you were walking. Any long-standing gait or balance or strength deficits, obviously depending on their severity as well. Interestingly, clinical diagnosis of depression increases your fall risk, and by not an insubstantial amount either. It's roughly about a 25% increase. The thinking behind that is that depression, by definition, depresses the central nervous system and creates a lag time in the performance of reflex action. So in the time that it takes you to identify a tripping hazard and alter the pathway of your leg to correct for that tripping hazard, the lag in time with depression causes a higher risk of falls. And then obviously any inability to perform activities of daily living. That's what ADL stands for. Activities of daily living.
Robert?
Yeah.
I've had a request if you could slow down a little bit.
Sure. You had coached me into that the last time, and apparently I didn't hear well enough, so I'm going to do my best to slow down. To reiterate, inability to perform activities of daily living independently also raises the risk factor for falls of all people, not just those with Parkinson's disease. Any cognitive impairments, the thinking there is that you cannot accurately assess the risk, say, of walking across a parking lot in the middle of the night and running a higher risk of falling because the processes that you're using to balance are not clearly thought through. And then taking any psychotropic medications, again, medications that alter the function of your central and peripheral nervous systems are going to increase the risk factor for you to fall in the next 12 months or so. And that's primarily what risk factor I'm talking about. I'm talking about the likelihood of fall within the next calendar year from this point on. And obviously, the more risk factors you possess, the higher your overall risk of falling. Okay. So again, still in addition to Parkinson's disease, approximately 33% of individuals over the age of 65 and almost 50% of those over 80 will fall within each calendar year, which is a pretty darn high number. Among those over 65, falls are the #1 cause of injury-related deaths. That includes car accidents. So falls actually claim more lives of those over 65 every year than car accidents do. And we all think of car accidents as one of the primary killers of people, and we all buckle up appropriately, but the probability is that the car accident won't end your life over the age of 65 as readily as a fall will. And 20 to 30% of falls result in moderate to severe injuries such as lacerations, fractures, brain injuries, contusions. Anytime you significantly cause a bleeding episode in your body, the risk of pulmonary embolism or stroke or myocardial infarction, heart attack goes way up. So the less you can injure yourself, the less likely you are to incur any other risk factors for death. So what does this all mean with this and then the risk factors specific to Parkinson's? So just as an example, an 81-year-old with Parkinson's has roughly about an 88% chance of falling within the next 12 months. And that means that none of these other risk factors were addressed. Some of these things are amenable to change, some of them they're not. Obviously, you can't change your age, but I'm going to go over a whole multitude of things in just a little bit that you can do to positively affect that percentage that I just mentioned. Okay, where do most falls occur? Roughly 75% of all falls occur in an area that we should all be very familiar with. I would hazard a guess that quite a few of you could stand in your living room, close your eyes, and find your way to your front door because you're that familiar with the setup of your home. So if that's the case, then why do 75% of falls occur either in the home or in proximity, such as the yard or the garage, or getting into and out of a car? The thinking behind that is that we are all distracted. Modern life is distractible, and certainly we are all victims of the multitude of inputs that are coming in all the times, and we're just not paying attention when we're walking through the house and we trip over a cord that we've seen 5,000 times, or we trip over the dog that was sleeping there that we just didn't pay attention to. Another 55% of falls occur inside the home. That's excluding the yard. So a large percentage of falls occur in an area that we should all be very, very familiar with, and often in the bathroom. Bathroom is particularly dangerous because the surfaces are often wet, and we're often in a relatively confined space in the bathroom, and it's difficult to turn effectively on wet surfaces. More falls occur on level surfaces, interestingly, than do occur on the stairs or on uneven surfaces. So essentially what it boils down to is that you're much more likely to fall at home on a flat surface than you are to fall in that darkened parking lot that I was talking about in the middle of the night. Okay, so ways to minimize the home and environmental risk factors are to review your medications and their side effects, talk to your doctor and or your pharmacist. I would say the pharmacist is probably a better source of information. If you're seeing multiple physicians at the same time and they're all prescribing medications to you, your pharmacist will know most of their interactions and how they could affect your cognitive abilities or your physical abilities. Take a moment to gather yourself upon standing up initially. Postural hypotension is when you change positions, like going from a sitting to a standing position. Your blood pressure will drop as a basic physiological effect. So that momentary dizziness that you're experiencing just after you stand up, if you go to take a step as you are dizzy and the floor isn't exactly where you think it is, and you literally either step on your own foot or step so that you twist your ankle, it's a much higher likelihood of falling. And by all means, this boils back to the problem that I mentioned, that most of the falls occur in a place that we're all very familiar with, inside the home and inside the near proximity. Move mindfully, pay attention to your surroundings. So if that dog is sleeping on the floor, walk around the dog, try not to step over it, and try not to get distracted with other activities, like trying to talk on your cell phone as you're running to try to answer the front doorbell. Okay. Other ways to minimize home and environmental factors are to install a night light to ensure that there's adequate lighting in any walkways at nighttime, or I guess we all learned that it can be dark in the daytime over the course of the last couple of days. So if your pathway is not well illuminated, the likelihood that you could not see something and trip over it goes up. Red light seems to be the best for visual acuity in low light conditions. So a white night light has a rather dazzling effect on the cornea and the retina, especially as it's turned on after your eyes had acclimated to the dark. So red for bed means that the ability to pick up the fine little details in the carpet, if the throw rug is folded over, your ability to pick that up with a red night light is much better than it would be with a white or a blue or any other color. Multiple different color night lights are available both at most major retailers like Target, or certainly online at Amazon.com. You can find night lights of all different hues and lumen powers to ensure that your walkways are adequately lighted. Adjust your bed height. So if it's difficult for you to get in or out safely of the bed, if you have to jump in, you may not quite make it all the way and may end up falling as a result of that. Or if you have to stand up from too low of a position, your body may also lose its balance as you're moving from an unusual position. So if you can adjust the height of your bed so that it's almost like getting out of a chair, maybe slightly higher, it's much safer to do so. So get rid of any throw rugs or throw mats, especially in the bathroom, because of what I mentioned earlier, that the floor of the bathroom can get wet, and then the rubberized coating on the bottom of the bath mat doesn't affect the grip nearly as much as if the floor is not wet. If you can't bring yourself to the point where you can get rid of the throw rugs, you can certainly nail them down or staple them down to the ground to decrease the risk that you would trip over that throw rug. Again, move mindfully, specifically when pets are running around at your feet, or running to greet you, or running to the front door to try to see who's there. Give the pet a space of time to move out of your way so that you can adequately make your way around it, or if you can't avoid not stepping over the pet, choose an extra bit of support to help you do so. Grab a hold of the countertop or a wall to help decrease the fall risk of stepping over something. Clear away any clutter to ensure adequate space. Make particular attention to this if you use an assisted device to walk, in that the space that you need to walk with a walker or even to walk with a cane is a little wider than it would be if you didn't have to. So if your hallways are relatively tight, or there's difficulty in the kitchen, in that a lot of appliances are sort of sticking out into the middle, try to move them away so that you don't bump into things and inadvertently cause fall because of something sticking out. So, and you can also install grab bars of proper height in the bathroom, and especially in the shower. And I would also say especially around the toilet as well, for those of you that have difficulty standing from the height of a standard toilet. There are contractors that are specifically certified, I think that's the right word to use, to install grab bars. So make sure that if you choose somebody to have them install your grab bars, that you do choose somebody who has been certified in the ability to do so, so that they don't put the grab bar in incorrectly. Again, the normal toilet height, thankfully these days, the ability to purchase toilets at different height is getting much easier. So if you cannot afford to purchase a new toilet that's a taller seat overall, if you can raise the toilet seat by using either a commode chair or just a raised toilet seat, as long as it's stable, that should decrease the weight transference that you need to do to come to a standing position after you've finished using the commode. Utilize a shower chair or a handheld shower head, or both. Actually, both would work rather well together when showering. Of the many falls that occur in the bathroom, the shower is actually the primary area that most people fall. It's usually a change in position in the shower with a slick floor. So for a high wall tub, if you don't have a walk-in shower, use a transfer bench, so you don't have to climb over the side of the tub. You can just sit down and swing your legs over. So I've included two examples of those in pictures, which I'll show here. The shower chair is on the left, and the transfer bench is on the right there over the high wall tub. So, and there's an example of a couple of grab bars in the shower as well. The only downside to this is if this person was showering with this transfer bench, is that if they were using a shower curtain, it would not close all the way past that bench. So If that is the case, you have to be mindful that there would be no water on the floor after you got out of the shower and went to stand up off of the transfer bench. Okay, so effective exercises to decrease fall risk. Individuals that exercise regularly maintain a higher level of ability throughout their lifespan. That's been very clearly shown in lots of good empirical research. 75% of older adults do not exercise at a level sufficient to gain the physical benefits of exercise. So that's a pretty darn high number. And what do I mean by sufficient intensity to gain the physical benefits of exercise? So you need to exercise for a minimum recommendation of 20 minutes 3 times a week. And that is best done with unbroken exercise, meaning walking for 20 minutes rather than walking for 10 minutes twice. If you cannot, if you don't have the time to walk for 20 minutes straight, then it is better to exercise 10 minutes twice or 5 minutes 4 times than it is to not do it at all. But suffice to say, the longer you can maintain a higher intensity of exercise, the more you will retain benefits from doing that exercise. Which means taking the dog out to check his pee mail doesn't really qualify as the minimum intensity of exercise. The intensity means you need to be either breathing hard at the conclusion of the exercise or sweating during, or hopefully both. I would digress here just for a minute to say that make sure you have the physical capacity to do that so that you can check with your doctor or your primary healthcare provider to make sure that your cardiovascular system is able to get you to the point where you can exercise when you're breathing hard and or sweating. But it takes that level of intensity to really receive the benefits of exercising. On the bottom there, I indicated the target heart range to enter the aerobic threshold. It does not mean that you have to get up to 60% of your maximum heart rate to receive the benefits of exercise, because certainly strength training will cause you potentially to breathe hard and or sweat, and that's not in the aerobic in threshold, which is what I've indicated there. But having said that, usually it is the easiest type of exercise to do. You don't need any equipment to walk other than a good pair of shoes. And B, you can do so with much more regularity because, well, barring air quality currently and fires and God forbid getting exposed to a virus when you're out walking, walking is the easiest form of exercise to do on a regular basis. Okay, so exercise is effective to decrease fall risk. I talked about, and I will talk about the LSVT program in just a minute. These exercises were pulled directly from that program. So the emphasis with LSVT is that because of the slower motion associated with Parkinson's disease, the slower movements and the lower amplitude, the smaller and slower movements, the process of LSVT takes the movements in the exact opposite direction. The movements are large, which is where the program gets its name. It's called LSVT big because all the movements done in this are big. So large motions done fast and repetitively so that we can hopefully reach that minimum threshold that I talked about, exercising for 20 minutes 3 times a week so that you're breathing hard and or sweating. So this is a lunging exercise. She has started from feet together position and she stepped forwards here with her right leg and she's thrown her arms way off to the side. So you take roughly a 24-inch step. Obviously that depends upon your height. If you're 4'8", you're going to have a lot more difficulty taking a 24-inch step than if you're 6'8". Suffice to say, take a very large step forwards, one that you can balance though, and then return to the starting position. So you have to be able to stride out into a large step and stop, and then return back to the original position with your feet together. So you can use your arms for balance, much like a tightrope walker would, and that you wave your arms to help maintain your balance. And that's why the arms, partially why the arms are stuck off so far to the side to facilitate that process. You can repeat this exercise, and I would highly recommend that you do both sideways. So she would be stepping sideways and then and or backwards, so that you have to control your balance in 3 different planes of motion. Another effective exercise, as I talked about just a minute ago, stepping sideways so that you stand with your feet together. Again, you take a really wide step sideways, you stop. If you notice in the picture, her foot is also turned in the direction she is striding. So as she's striding out to her right side, her right foot is turned to the right. That decreases the support that she's got below her leg and makes the exercise just a bit more challenging to maintain balance with. And obviously you would repeat it to each side in equal number of times. I guess an appropriate question I can ask myself is, well, how many of these exercises should I do? And then again, that really gets back to the 20 minutes. Yeah, Mark is doing an excellent job of demonstrating right now. Although your arms are a little too low, Mark, and your step's not quite far enough. And that's the real benefit of coming to physical therapy, is you get somebody to criticize everything you do. Just kidding. So another effective exercise, it's called rock and reach. You stand with your feet 24 inches apart. You aggressively rock your body weight, and this gets back to the bradykinesia and the hypokinesia. So you're actively forcing your body to move in a way that it's not accustomed to. So as you do so, your brain will recalibrate the motion so that it becomes more normalized, or what we all consider a normal speed and size of motion. And that's really the benefits of the whole LSVT program. I'm going to use the word neuroplasticity, but I'm going to try to explain it as well. Neuroplasticity means that if you require your neurological system, your brain and your peripheral nervous system, and you force them to adapt to certain set of conditions, they will do so by adapting. So as a muscular example of this, lifting weights to make yourself stronger is muscular adaptation. So you lift weights aggressively enough weight and at sufficient times, your muscles get stronger, they get better at doing their job, essentially, is what that boils down to. The neurological system responds in the same way when asked to do so. The asking, though, is the tough part, because that takes roughly about 6 months or so of exercise to really start to see the neurologically based benefits of exercise. So that if you were, say, to sprint, as an example, across a grassy field, repeatedly, your body and your brain would get much more adept at making that motion happen. Obviously, we're all human beings, and there's a ceiling effect in what we can accomplish. But the neuroplasticity and the muscular adaptations allow you to continue to strive, at the very least, and hopefully continue to improve your overall physical function, both in the speed of motion and the amplitude, the size of motion, to combat the effects of Parkinson's. There's ongoing research to see if LSVT can actually reverse those effects. I haven't heard anything in about 3 years, though, so I'm assuming they're still tabulating the information. But the thinking is that if you can aggressively work on the neuroadaptive properties of this particular exercise technique effectively, you actually improve physical function to the point where the associated deficits with Parkinson's are almost unrecognizable to a layperson. Okay, excuse me. Another effective exercise to decrease fall risk is the standing turn. Turning, specifically turning in the kitchen, turning in the bathroom, are an awful lot of reasons why that number, that 75% of falls occur in the home, in the garden, is so high. As we turn, our body is shifting on top of our base of support. And as we do so, oftentimes our base of support is not completely underneath us. So the more you can practice that, and all other skills for that matter, as I talked about neuroplasticity, essentially what it boils down to is the more you practice things, the better you get at them. That's true for painting a picture. It's true for playing a violin. It's true for almost all activities. Thankfully, these exercises are not as complex, say, as playing a violin would be, but they will respond, your body will respond in much the same way in getting better at doing all of these things. So you get more attuned with where your body is on top of your base of support, and conversely, where your base of support is beneath your body. Okay, here's the advertisement for LSVT. Empowering people with Parkinson's disease. LSVT Global is the parent organization. There is also LSVT Loud, which I did not talk about because I'm not a speech therapist, but LSVT Loud works on the decreased vocal abilities for those with Parkinson's. So it certainly would be something else to investigate if you feel like you have that problem. So LSVT Global is the parent company. They do have a website, lsvtglobal.com, which would be a great resource to go find folks in your area who are doing loud. I'm assuming all of you are in my area, so you can also find me on that website to do LSVT Big. But it talks about the research behind all of this, which I don't go into in great detail here. This was meant to be more of a hands-on sort of nuts and bolts thing. But there's a substantial amount of research that's been done to prove the efficacy of this particular style of exercise against other styles of similar styles of exercise. The Rocksteady boxing program, for one, Tai Chi for those with Parkinson's, all have benefits. And I'm not trying to dissuade anybody from performing any of those other types of exercise. In fact, the more exercise you can do, the better. It's just that the other types have not been clinically and empirically shown through research to be effective against combating the effects of Parkinson's, and LSVT Big has been. And that's my, as I said, my ad for LSVT Big. So the programs are administered in a one-to-one session, meaning if you do come to see me, we would exercise together. I would be doing the exercises with you, and then talking through ways to make them better, ways that you can improve your movements and decrease your risk of falls. This all challenges an impaired system. I talked about neuroplasticity and muscular adaptation. Those are the things we're seeking to challenge with this program. We're seeking to make your body more effective at doing its overall job, which is living your daily life, and building in capacity that you probably don't currently have. So these techniques are specific to Parkinson's related specific deficits. I said specific twice, sorry, that's a typo, which we work on combating the effects of slow movement and reduced movements and improving your overall sensory awareness of how you're moving so that the movements that you produce do not appear to the rest of us to be Parkinson's related. Okay, so how do the LSVT Big program daily affect you? It can improve your ability to start and stop movements. It can improve your ability to change direction with more confidence, ease of making turns, increases your endurance and your stamina. It improves your balance, your strength, your range of motion, and overall posture. All of the things I'm stating here on the slide have been clearly shown in a body of research. Points to remember. Parkinson's disease is a neurodegenerative disorder that affects balance and movement, pleasure, attention, mood, and motivation. As I said, particular to that last part of the sentence, motivation is a very tricky thing, especially when you've been given a diagnosis that you feel is going to end your life. So remaining motivated to then turn around and try to combat the effects of that diagnosis can be very difficult. That, as I said, I think is a topic for an entirely different lecture, how to improve mood, cognition, and motivation. But suffice to say that they are affected, and as long as you understand that the loss of dopamine may actually affect your motivation to exercise, sometimes it's easier to combat if you know why it's occurring. Prevention strategies overall have been shown to decrease risk by about 31%. So that is the environmental factors I talked about, the red night light and the nailing down the rugs in your house, removing clutter. All of those things can reduce your fall risk by about 31%. So that suddenly takes the 88% from a 81-year-old Parkinson's patient, and it reduces it by 31% just by changing your home environment. Targeted specific PD exercises affecting or addressing things like balance and flexibility and strength training can also decrease your fall risk by about 17%. That 17% though is conditional upon the time frame that I mentioned earlier. An exercise program to show those benefits needs to occur at least 3 times a week and needs to occur for about 6 months of time. So this is not an insubstantial time requirement we're asking from you. But having said that, if you can reduce your fall risk by roughly 50%, so changing the environment in your home and in performing the exercises will hopefully reduce your fall risk by about 48%. That I don't think is an insubstantial change. It's a pretty big improvement in something that could potentially end your life. 75% of older adults, I said this earlier, I'm not going to beat it up too much, but sufficient to say that chances are very good that you are not, if you are engaging in a regular form of exercise and you're not sweating and or breathing hard when you're done with that particular exercise routine, it's probably not of sufficient intensity that you're going to improve your physical capacity. So fall risk and management needs to be a team effort. I listed therapists there obviously because I'm a therapist, but I don't think of us as the primary person involved in fall risk management. I actually think of that as you all being the primary person involved as the team leader in your own fall reduction or balance improvement plan. Okay, couple final thoughts for me. So if after listening to all of this, I'm not going to ask you all to chime in with this because I can't hear you. If you had to list your own perceived fall risk on a scale of 1 to 10, that as you can see from the scale there, 10 is very likely that you're going to fall within the next 12 months. And 1 is essentially no risk of fall within the next 12 months. So if you had to think about yourself, where would you put yourself on that scale? I'm going to give everybody a chance just to think about it for a minute. Well, a little less than a minute. So I would ask, hypothetically, I guess, why didn't you give yourself a 10? So why isn't it very likely that you're going to fall within the next 12 months? So if you thought to yourself, well, my legs are pretty strong, I'm probably not going to fall because my legs are strong and they're going to help hold me up. So if you believe that that is the case, that is what you should concentrate on in any program that you're going to decide to do to decrease your fall risk. You should work towards your strengths. A physical therapist like myself will help you identify the weaknesses in your body and have you work towards those. But the one thing that you think is the best overall possible way that you can avoid falling, like strong legs or fast reactions, that's what you should work on primarily, because it's obviously what you feel like your strength is. Hopefully you'll be more motivated to work on it. Hopefully you'll see faster results because it is indeed one of your strengths. Okay, and why didn't you give yourself a 1? So looking back at that slide, if you have no risk of falling within the next 12 months, well, I would say also, why are you listening to me talk today? But if you have a very slight risk, say if you list yourself as number 3, why did you give yourself a number 3? So that particular aspect for you, whatever it is, if you think, well, I'm very tenacious, so I'm going to do all of these exercises and I'm going to have a very slight risk of falling. Well, if whatever that is for you, as long as it's under your control, that's what you should use as your motivation to keep you exercising. Because if you start, exercise is an awful lot like dieting, in that if you diet 1 day a week, there's going to be no appreciable benefit that you're going to see from it. If you diet consistently, if you exercise consistently, you're going to start to see the benefits. As with dieting, though, as soon as you stop exercising, the benefits are going to start to fade away. So if you want to maintain a particular weight, you have to diet effectively until you reach that weight. What do you do when you reach that weight? Every once in a while, you have to go back on the diet. So once you have attained, hopefully, through vigorous exercise for roughly about 6 months, a very much higher level of function, you should strive to maintain that level of function by doing A, whatever's most fun for you, because that's most likely to get done, and B, whatever you feel like effectively addresses the problems that you have in particular. Thank you all very much for listening to me talk for the better part of the last hour about this particular subject. Hopefully you learned something that you can take away immediately from this presentation, like buying a red night light to help light your path at night, or nailing down throw rugs so that you don't trip over them. I would also say, please look into, if not investigate, the LSVT BIG program. At least from an anecdotal point of view, I have seen it make huge changes in people's functional abilities to be able to get out and do the things that they want to be able to do. Hopefully, at the very least, I piqued your interest in something, if not the LSVT BIG, in some other way you can strive to improve your current physical capacity.
Thank you very much, Robert.
Thank you.